Hi everybody. Just gonna get started. Hi. Hello everyone. My name is Dr. Eileen West and I am a general internist in Fairfax, Virginia. And I am looking forward to having a chance to talk with you today about our practice. So we're going to give everybody a minute or two to get set up here and to look at some of the comments. Pull up the information. Anybody joining in? Oh yeah, we've got a few people on. Hi everybody. Everybody another minute to get on the call. Welcome. Thanks for joining in. All right, I'm going to go ahead and get started. Welcome everybody. So glad to see you on Facebook. I am eager to have a chance to tell you a little bit about our practice and give you a chance to learn about what we're doing. So my practice is a concierge internal medicine practice, and it is located in Fairfax, Virginia. I began this practice about 18 months ago. A little bit about my background. I've spent 20 years as an internal medicine physician with a focus on women's health. I did my undergraduate degree at Yale and received a medical degree from the University of Connecticut, completed my residency training at Tulane, and also did an additional year of office gynecology at Louisiana State University. I'm board certified in internal medicine. I'm also certified in menopause management and osteoporosis management. 14 years of my career I spent working as a professor, a clinician, educator, a teacher of young doctors, and also a practicing physician at the University of Oklahoma. I moved to Virginia 6 years ago to work with Inova as the medical director of their Comprehensive Women's Health Center. And in November of 2019, I opened my own concierge practice around the corner from Fairfax Hospital. And the intent is to focus on comprehensive evidence-based care for women. I got interested in medicine because I realized that it would allow me to learn something new each and every day, and that I would be able to turn around that information and use it to help someone else. Women's health has always been a particular interest of mine. I've always had a strong community of women around me, and I've recognized through the years that many times their needs were not being met, and I wanted to learn how to help them. So for example, my mom, who's now 90, fell and broke her wrist years before I started medical school. She was diagnosed with a simple wrist fracture. I mean, at that time, there was not a focus on running bone density tests and thinking about the fact that fractures were often the first sign of a condition called osteoporosis, or thinning of the bones. And if she had been diagnosed a little more quickly, then she might have been able to start medications that would have helped to strengthen her bones. And because she was unable to think in that, her doctor wasn't thinking along those lines, she did not receive the necessary testing or the necessary treatment that might have helped her prevent future fractures. She's had 7 fractures now. She required weeks of time in the hospital and in physical therapy rehab, and that might have been avoided. So one of the things that I care very much about is making sure people are thinking about their bones and about bone health as they age. Throughout my career, I've cared for over 8,000 patients with excellent success rates. I've been honored to be voted as a top doctor by my peers everywhere that I've practiced. And I've also trained hundreds of young physicians as they learn the craft and the practice of medicine. My years of caring for patients in the hospital taught me how to handle complex health issues, to identify a problem, consider the evidence around what could be causing it, and to make an accurate diagnosis. And it's also taught me that our current primary care system leaves a few things to be desired. I also learned just that despite many advances, women's healthcare is still underdeveloped, and we need to shine a spotlight on it and to make good things happen. So today I'd like to share some important information with you about why you deserve better health care. And I would invite you to join in on the discussion. Go ahead and ask your questions in the comments portion of the video. I'll be happy to answer them when we move into the Q&A session. See if I can find the questions. 1 second here. Well, I can't see the questions right away, so I will keep looking for them. All right. So why do you deserve personalized, comprehensive health care? I'd like to talk a little bit about the current landscape in healthcare. We've had a lot of issues recently with our healthcare system being focused more and more on the financial motivation behind the practice of medicine and on volume over quality of care. There are more and more specialists, more and more services to be offered, and larger systems offering those services. We all want to provide excellent health care, but what we're finding is that when things become crowded and rushed and busy, it can be really problematic. And I believe that physicians and patients both have really started to notice that there is a problem with time and a problem with attention to detail happening in our healthcare world. In our current system, physicians need to see more and more patients to stay financially viable. This can create a bad experience for you, the patient. You've probably experienced the frustration of waiting for weeks or even months to see a physician. On average, Americans wait 24 days to see a new doctor, up 30% since 2014. And when you finally do see the physician, the appointment is often rushed. Right now, in most clinics, a healthy 30-year-old with no health problems other than seasonal allergies might get the same amount of time on most physician schedules as an 87-year-old with 12 medical issues. can be really challenging to take good care of that older patient with multiple health problems, particularly when you only have a very limited time to do it in. The average primary care physician appointment these days lasts about 7 minutes, and it's not enough time with the physician. You really deserve more proactive, more comprehensive care. Wouldn't it be great if healthcare offered the same convenience, access, and customer-centered experiences you receive from the restaurant business or the retail business or mobile technology? But unfortunately, we just don't see that as a standard of care across the practice of medicine. I also really want to emphasize the importance of evidence-based medicine. And what is that, and why does it matter to the patient? For as long as human beings have had symptoms of illness, there have been many treatment options to relieve suffering and fight disease. Some of those treatments work better than others. Practicing evidence-based care means that I and my colleagues have a commitment to study and learn about the most up-to-date scientific data available to help determine which treatments work and which treatments don't. And that is the science of evidence-based medicine. There are randomized controlled trials which are performed where you compare in a controlled setting where variables are left out of the equation to determine how much a medication or a therapy of any kind really helps. And it's very important to understand what those studies show, because it's not always immediately intuitive. And it's important that we realize that there are thousands of people in the healthcare world who are working very hard to gather this data so that we know what to put forward as a best practice for care so that we can have the most success and the best outcome possible. It's also been very important to me to recognize gender-specific care. Miss Medicine does an excellent job with this, and I'm happy to be affiliated with the Miss Medicine organization. Women have unique needs, and healthcare is not a one-size-fits-all proposition. In the early 1990s, a massive shift happened in medicine that opened up the scientific world to studies with women. And ultimately, that allowed healthcare through the lens of gender to emerge. So we now have a deeper understanding of some of the most commonly associated women's health topics: breast cancer, pregnancy, sexual health, menopause management. But we've also come to understand that it's not just about bikini medicine or, that focus on boobs, ovaries, and vaginas. There's a lot more to women's health. Women are more prone to joint pain, they're more prone to migraines, they have autoimmune disease at a significantly higher rate than their male counterparts. We also know that women have symptoms which may present differently, such as that of a heart attack. And we also know that hormones can interact with medications differently. There are fluctuating levels of hormones throughout a woman's life, and those fluctuating levels of hormones influence how medicines and other treatments work for us. For example, did you know that an insulin level needs for a diabetic patient change during the menstrual cycle? Somebody who has an insulin pump has to dial up the amount of insulin they use during certain times of the month in order to be adequately covered. And this is important and relevant information for lots of type 1 diabetics. There's so many examples. Miss Medicine is a national practice model of women's health trained providers focusing on addressing the unmet medical needs of women. And it's a very exciting terrain, and there's lots of good work being done in this area. I'd like to shift gears now and talk a little bit about what concierge primary care is. Concierge primary care is an emerging healthcare model. It focuses on accessibility, personalization, affordability, and ultimately better health and wellness for the patients who are part of a concierge practice. You often will be able to get convenient detailed, comprehensive care from an expert who takes the time to know you and your medical history and is able to build and manage a personalized care plan. Concierge physicians typically see far fewer patients, and patients pay a membership fee to help cover physician costs for this enhanced level of service. So what are the benefits of concierge care? First off, the quick and convenient access directly to your doctor is usually a part of every concierge practice. You can access your doctor through phone, email, texting. It reduces wait time and ensures you get the most informed care, whether to address a routine question or to treat something urgent. You typically will also get more time with your doctor. On average, concierge physicians spend 6 times more time with their patients each year. They're able to work together on comprehensive disease prevention, on longevity, to focus on well care, not just sick care. And that can be challenging in a routine primary care setting. We're also able to spend more time helping to manage chronic conditions like diabetes and heart disease, and frequent visits are easy to arrange, and follow-up is also usually much more consistent. Another nice thing about a concierge practice is a more personal relationship with personalized care. Almost all concierge patients think their doctors take a personal interest in their health, and the number that say so is more than 1/3 higher than those in regular practice. Over 90% of concierge patients are highly satisfied with their care, compared with about 67% in the traditional healthcare model. And all of this, we really truly believe, adds up to better health. There's one concierge medicine organization nationally that reports 70% fewer hospitalizations among their patients versus patients in traditional primary care offices. And concierge patients were in the top 10% of national benchmarks for control of chronic conditions like diabetes, high blood pressure, and high cholesterol. So let me tell you a little bit about my decision to open Eileen West MD and Associates. I'm someone who values close relationships with others, and I want to bring a rigorous interdisciplinary approach to care. Throughout my care at large healthcare systems, I've had patient rosters of as many as 3,000 patients at a time, and I was only able to spend, on average, maybe 10 to 15 minutes in an appointment with them, a follow-up appointment with them. I wanted to be able to get to know my patients better, to provide more comprehensive preventative care, and to be there for my patients when they needed me. At the same time, I wanted to go deeper into healthcare through the lens of gender. When I got connected through a colleague with Miss Medicine, I had an immediate connection with the founder, and I knew that we could be great partners. Last but not least, after 20 years in large healthcare systems, I was ready for the autonomy of running my own practice and to be able to do things the way that I felt were the best way to do it. So I opened up my concierge practice in 2019. The office is right across the street from Inova Fairfax Hospital. I continue to be affiliated with Inova, and I now care for a few hundred patients, not a few thousand. I'm even more closely tied to women's health best practices through Miss Medicine. And for the first time in a while, I truly love my job. So why might you consider, as a patient, investing in yourself for a concierge practice? The most important investment you can make is your health, and it has a ripple effect throughout everything in your entire life. So it's worth some extra money to go ahead and achieve and to receive this higher service level. There's concierge level care through a gender-focused lens. You get all-inclusive primary care provided by a women's health trained physician for one annual fee. You have access to me through phone, cell, and email, including telehealth. And at the end of the workday, my phone rolls to my cell phone and I answer my cell phone and I'm able to help you. We are able to guarantee same day or next business day or just urgent visits. And there's more time on average spent in appointments. Our appointments run 30, 60, or 90 minutes in length in this setting. There's a detailed annual physical and wellness visit. We offer blood work. We offer body composition testing. We offer nutrition and fitness, functional fitness consultations. I'm able to do breast cancer risk assessment. I'm able to screen for mental health issues, for sleep apnea, for sexual health concerns. We do a basic vision and hearing screening, and we can talk at length about wellness and disease prevention strategies. I'm also able to offer IV fluids and medications in the office when appropriate, and sometimes that allows us to prevent urgent care or ER visits. We also have convenient access to in-office lab tests, vaccines, and medical supplies. And we're able to offer coordination of care with specialists and with other medical testing. Let us do the work for you. We can make the arrangements and set up your day of wellness testing so that all you have to do is be at the right place at the right time. So if you decide to join the practice, how does this work? In your first few months, at the beginning, you'll come in. We offer what we call a meet and greet appointment, where you have a chance to meet the staff and talk with me at length and get any final questions answered. Then you'll complete some membership paperwork and provide contact info for other providers so we can contact them to collect information about your medical history. I'll go ahead and review the history, and then we'll schedule you to come in for an initial exam. And after that, we will go ahead and get the documentation secured in our computer system, and we'll schedule nutrition and fitness consultations, as well as more in-depth conversation based on the original assessment and what additional concerns you may have. And then, of course, I'm available on call as needed. So it really can be a wise investment when you think about it. A number of my patients have said that the reasonable annual fee actually pays for itself pretty quickly, given the detail of the comprehensive annual exam and the fact that there are no copays or deductibles. The annual membership fee is just $2,750. We have flexible payment options, and we have reduced rates for your partner or for your dependents. And yes, I do see men too. I always have, and I was trained to take care of both men and women, and I really enjoy taking care of families. So membership can result in lower healthcare costs overall. I mean, there are a lot of extra services that you would normally have to pay additionally for: nutrition and fitness consultations and multiple in-depth assessments. Especially if you have a chronic illness, that requires frequent interaction with your primary care doctor, you may save on the cost of repeated appointments with a traditional primary care practice. And then the convenient access can really help reduce emergency room visits and hospitalizations. So how does this work with insurance? People ask me that a lot. You should continue to have healthcare insurance to cover services outside of your primary care office visits, such as labs, prescriptions, visits with specialists, or hospitalization. Insurance does not yet cover the membership fee, although health savings account plans are moving in that direction. And you can at least pay part of the cost of the membership through a health savings account if you have one. Insurances will also reimburse fees for in-office services like labs and imaging. We collect payment at the time of your appointment, and then we provide a receipt for you to submit. Services that we offer here are considered out-of-network, just so you know, and that includes Medicare services. I am out-of-network with Medicare, and I have lots of Medicare patients, but filing additional bills with Medicare takes a little bit of extra effort. So transparency is a key benefit of becoming and being a member of our practice, and that includes your membership investment. We will never hesitate to talk with you about cost and about pricing for specific tests. We don't want you to be caught in a situation where you're blindsided by unknown insurance costs and not understanding what the benefits really are. So it's pretty straightforward and pretty clear in our setting. So just to reiterate the benefits of being in a concierge practice, you get convenient access to your physician, you'll have more time with me or whoever your physician is, you have accountability with your healthcare goals, and support on your wellness journey. It's really nice to have a relationship with a physician who cares about you and who is an expert in women's health. It's like having your own doctor in the family. So if you feel ready, go ahead and call our office or email us to set up your membership. There are links on my website, eileenwestmd.com. Or if you still have questions, you can schedule a personalized session called a meet and greet, and you'll come in and we'll talk, we'll visit, and we can help to identify what your specific needs are and to tailor a plan that works best for you. So I really hope that we are able to work together at some point in the future, and I look forward to meeting you. All right, let me see if I can find the questions here. Not sure if there are any questions. Sorry, I'm unable to view. Oh, here we go. Here are the comments. I found them. Aren't we all still getting used to these? Well, I don't seem to be able to open my questions today. I'm sorry. But I will go ahead and answer those questions for you at a later time. So stay tuned. Oh, here we go. Maybe I can, let's see. Nope, I'm not able to open the questions. Here we go. Okay. Would this be a good option for someone with chronic disease? Absolutely. We see, I would say that I have a mix of relatively healthy people versus people who have a couple of specific chronic conditions that require frequent contact with the doctor. One of the advantages to this type of model for me as a physician and for you as the patient is that I have time to reach out to your specialists or to come and check on you when you're in the hospital, so that I'm able to provide that 360-degree view of your health issues, which can just make for better care, quicker recovery during an acute event or acute incident related to your chronic disease. So absolutely, I feel very comfortable managing a number of different chronic conditions, whether they're autoimmune related or diabetes, high blood pressure, cholesterol, chronic migraine problems, any manner of chronic illness. I have, through the years, been very fortunate to have some excellent training and to feel pretty comfortable managing a lot of these types of illnesses. So I heard concierge care is a good way to work toward disease prevention. What does that look like? All right, so in my practice, what we will do when we meet you, I have a dietitian with whom I work closely. I also have a functional fitness group, which a provider who is able to do functional fitness testing with the practice. And we will start with taking a look at overall diet, health, and lifestyle and health patterns. We'll assess diet. We can do a functional fitness test, which tells us where your strengths are and whether or not there are any particular weaknesses that might either make it, put you at risk for injury if you start an exercise program, or just to help you get started with some kind of program that will allow you to be your best self. And we are able to follow through on those activities and to offer more time for education and training. And I have lots of additional resources that I'm able to offer you and to make available. So, what are some women's health issues that I cover with patients? There are quite a few areas of women's health that I think people seek out special care for, and I'm comfortable managing these. One that I do very frequently is menopause management. Another is, and that can be with lifestyle adjustment, with medication changes, addressing underlying health issues which might be causing similar symptoms, really taking a look at what it is about making that menopause transition that may not be going smoothly for a person and how to help them feel better. I also do a lot of work with cancer survivors, taking a good hard look at what screening tests are required and how to be a little more proactive about managing care. I also do a lot of work with osteoporosis, have throughout my career. I've interpreted thousands of bone density tests at the University of Oklahoma, and am very comfortable with management of this disease in order to do our very best to prevent fractures and further decline in bone health. I'm able to manage women's sexual health. There are a lot of issues in women's sexual health which just don't get addressed. Either people are afraid to bring it up, or they don't really realize what the breadth of treatment options there are that are available. And I'm happy to do consultations on sexual health to try to address some of those underlying issues. We use a biopsychosocial model to evaluate the big picture for sexual health and help women, be healthy in that regard and to enjoy a necessary and wonderful part of life. So those are the types of women's health services that I offer. I also do all routine gynecologic care, pap smears. I can place IUDs, offer recommendations about birth control management. We also do, prenatal carrier testing. We can do breast cancer risk assessment and look at hereditary factors that might be associated with cancer risk, and what the appropriate types of tests are to be done for a woman who might be higher risk for breast cancer. And all of these things really add up to, being proactive about one's health. So, what do I like most about offering concierge care? What's the favorite part of my job? My favorite part of the job? Oh, wow. There are so many good things about it. I love being able to relate well with my patients and really get to know them over time, so that I can have the big picture for their care and their health. And really, it's very gratifying to be able to make a diagnosis for somebody who's been having symptoms for sometimes a year or more, and to be able to make a diagnosis and to allow them to feel better. I also, and then to watch them grow and develop over time. So you really, that's probably the most fun part. I like the challenge. I am a diagnostician at heart. I like to be the first one to hear the story and to try to figure out what's wrong and then to be able to solve the puzzle. So that works well, and I have lots of patients who come to me with lots of problems that haven't been solved yet, and we work our way through them one by one. It's very satisfying. So all right, let's see if we have any other questions here. How can I sign up to become a member? Oh wow, I haven't said that yet, have I? There are a couple of different ways to sign up. We can, what we can do is give the office a call or go ahead and email us through a contact form, and we'll reach back out to you. There's a contact form on my website, www.eileenwestmd.com, and we can either schedule a meet and greet and meet in person, and then you sign up at that first appointment, or we can do the sign up remotely. We can do it through telehealth or over the phone. So it's really not a difficult process. We have some forms for you to read through and to sign, and then we set up a payment plan, and then we jump right in and get you started on your path to better health. All right, I think I have all of the questions, so I will go ahead and end here. I want to say thank you all for listening, and I hope that you learned something. I hope it was informative, and I really hope that we may be able to help you in the future. Give us a call, 571-999-9378 or eileenwestmd.com. Thank you so much for listening.